My name is Dr. Whispers, and I will be carrying out your cranial nerve examination today. Now, I don't believe you've come to see me before. No? Okay, now I'd just like to ask, is there any particular reason why you wanted to be booked in for a cranial nerve examination? Okay, so just for a bit of reassurance. I understand that's quite common. So a cranial nerve examination is going to test the nerves that are supplied to your face. So for example, your hearing, your eyesight, your sense of smell and taste, and your sensory nerves. Okay, so if you just like to make yourself comfortable, help yourself to some water just there, and I will get things ready. Alright? Okay, so we're sitting comfortably. Lovely. Now, the first test I'm going to do is an eye test. Alright, now can I ask, do you wear glasses, contact lenses? No. Okay, and have you had any problems with your vision lately? No. That's great. Good. Okay, so let's get started. I have one of these, which you may recognise from going to see an optician. This is a pretty standard test. What I'm going to ask you to do is just stand behind. Can you see that line? Just behind you there. If you just wouldn't mind just going to stand behind that, and I'm going to ask you to close one eye. We can hold your hand, whatever's easiest, at a time, and I'm going to ask you to read the letters. Okay? So if you'd just like to pop behind that line. Okay? Okay, so can you see it? Yeah? Lovely. Now if you just like to close, that's it. And if you could just starting with my pen from the top line. Good. Lovely. Good. Onto this one. Good. And this one. Good. And onto this line here, please. Good. And moving on. Very good. And down to this line here. Very good. Very good indeed. And moving down now to the last three lines. Good. Very good. Now don't worry if you can't read them, okay, but if you could try and read this for me. Can you read that one? Okay, that's fine. And now if you'd like to cover the other eye, please. Thank you. Okay, let's do that again. So starting from the top, please. Nice and easy. Moving down. Well done. On to the next line for me, please. Good. Getting through these nice and quick. Onto this line. Good. Moving down to here. Down to the last three again then, please. Good. And this line, please. Okay, lovely. If you'd just like to take a seat for me, I'll just make a note of that. Okay, so your vision on that test seems to be fairly even. I know you got a little bit further for one eye, but I mean, comparatively, it's fairly similar. Okay, so what I am going to do next is a light test. This is going to let me have a look at your pupil reactivity, okay, and just a closer look at your eyes. So let's get my torch. That's actually why we've come into this slightly darkened room today, just so you're able to see the torch properly. Alright, so if you just like to keep nice and still for me, this is going to be fairly bright, so your eyes will probably take a moment to adjust, which is fine. But let's have a little closer look. Alright, now I'm just literally having a little look. Okay. Your eyes look in good condition. There's no sign of any damage. I'm just looking just there. Looks. Could you just look up for me? Okay. Good. All looks fine. Okay, what I'm going to be doing now is just doing a little test with you. Okay, so I'm going to be moving the light from side to side. This is actually called a little swing test. Well, not a little swing test, but a swing test. And all I'm going to do is just move it quite quickly, like so, from side to side. Alright? Okay, just follow the light for me. Okay, so let's begin. Good. Okay, I'll stop that now. I know it's gonna make some people feel a bit dizzy, so I won't do too much of that, but that all seems fine. What I'll now do is just a little follow test. Okay, so all I want you to do is just follow the light for me. Okay, so start here, just let your eyes focus, and good. Doing really well. Lovely. Lovely. Okay. You are doing really well. Okay. Let's finish that there. A couple of notes. Okay, so your vision looks in really good health, so that's brilliant. Pupils are reacting normally. I can't see any deformities in the eyes, any causes for concern, so that is excellent. Alright, so that is the sight part of the examination finished. Yes. Now, what we'll move on to now is your hearing. Okay, so for that, what I'm going to be doing is coming round to either side of you, and I will be just making some different sounds. Okay, now you won't know what these sounds are because you'll have your eyes closed. Alright, I'll be using different objects, and all I want you to do is to try and identify the sounds for me. Okay, understand? Perfect. So, sitting comfortably? Good. Now, if you'd just like to close your eyes for me and the hearing test can begin. Okay? Lovely. So, let's get started. Are you ready for your first sound? Okay. Okay, are you able to tell me what you think that sound is? Very good, very good. Okay, I'm just going to test some more now. Can you identify what that sound is? Yeah, that's close enough. That's good. Okay. identify that sound for me, please? Yes, very good, very good. Okay, I've just got a couple more for you. You're doing really, really well. And if you could just identify that sound. Very good, you're doing very well. Are you sure you haven't done one of these tests before? Okay, let's have a look. Are you ready for your next sound? Wonderful. Okay. Okay, and if you could just tell me what you think that sound is. Very good. Okay, lovely. I've just got one more sound, alright? Now, lots of people don't get this, so don't worry if you can't, but let's have a try. Now, have you got any idea as to what that is? Oh, almost. Little cotton ball ping doll. Yeah. It's quite a delicate sound, so it's quite a good one to test, but you were close enough. Right, I will come back round. Okay, well, I can tell you that your hearing is absolutely fine. In fact, really, as you were able to identify nearly all of the sounds correctly, I would say you have excellent hearing. Now, if you hadn't have been able to identify any of those sounds, or the majority of them, what I would have done is just some further testing, just to isolate either ear and just have a further bit of testing. But your hearing is absolutely fine. So let me just make a note of that and we can move on to the next test. Alright, do help yourself to some water, as I say. No, it's quite warm in here. Okay, so the next thing that I'll be testing is your olfactory nerve, otherwise known as your sense of smell. Alright, now, have you suffered with any loss of smell recently? No? Any changes in the way you smell familiar things? No. Okay, that's great. What I've got here is some essential oils. Okay, so they're things that you would recognise, okay, familiar scents, but they're just in a purified form. Alright, so I have my little bottles here, and if I could just ask you to identify the smell. Alright, so I'm going to pop them on a little bit of cotton. Okay. Now, if you just like to, some people like to close their eyes, whatever you prefer, and just have a little smell. Yeah, that's fine. Sometimes it can be a little bit confusing until your nose adjusts. Okay, what do you think that first smell is? Very good, very good. Yes, that is cinnamon. Well done. Just note that down as correct. Okay, let me grab my next scent. Now this next one, I will warn you, is a little bit strong, okay? This has caused some of my patients to sneeze, but just warning you. Okay. Yeah, you know what that one is straight away. Yes, pepper, yeah. Well done. You didn't sneeze though. Okay, let's pop that in. Wonderful. Now let's move on to the next one. I've only got a few of these, okay? Yeah, good, that's fine. Okay, and what do you think that is? Very good. Yes, that's rose oil. Yes. Okay. One of my favourite scents, actually. Just got a couple more to go. Okay, you're doing really well. Okay. Are you ready for your next scent? Okay. Again? Still unsure? Would you like one more sniff? Yes, of course. That is the one. Yes, this is tea tree oil, okay? Often used in medicinal things. Yeah, especially good for treating spots as well. Yeah. Okay. Not bad at all. I've just got one more scent for you. So let's see if you can get them all right. Okay. Yeah. One more. Okay. What do you think that is? Very good. Yeah, coffee. Well done. Okay. So, you have passed that with flying colours. Well done. Just finish making a couple of notes. Okay, so the next thing I'm going to do is test some of your facial nerves. Alright, so I'm just going to put my gloves on. just warm them up for you a little bit. They've been in a very cold cupboard. So I'll just hold that for you. Okay, so I'm going to come a little bit closer. Okay, so what I'm going to try and do is just test some of your reactions to things I do on your face. Alright, it's just going to tell me if the nerves are all functioning correctly. Okay, so the first thing I want you to do is just to close your eyes, and what I'm going to really try and do very, very gently is just try and open them. Okay, so I'll just be lightly lifting the eyelid. Okay, and what I want you to do is to try and resist. Okay, so try and keep your eyes closed. Okay, so I'm going to try and lift one eye at a time. Okay, so just close those eyes for me. Let's have a go. Good, just try and resist. Lovely, let's try the other eye. Good. Okay, that's great. We're going to do the same thing but with your mouth. Okay, so if you just want to keep your mouth in a smile, and I'm going to try and turn it into a frown. Alright? Okay, so give me a nice smile. That's it. Okay. Good, and just try and resist. Well done. Okay, that's brilliant. Now what I'm going to do is to use a little cotton ball here. Okay, I'm actually gonna take off just a little bit of it, and I'm going to use this to lightly touch areas of your face. And with your eyes closed, what I want you to do is just tell me which area I'm touching. Okay? Alright. Good. 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 Good, very good. Just a couple more. Good. That's it. And good, good. Okie dokie. Let's get ready for the next part. Okay? For the next part, I'm going to be testing your sense of taste. Okay, so I've just got one very simple test for this. So if you wouldn't mind just closing your eyes, and all I'm going to be doing is just placing something on your tongue, okay? I promise it's nothing horrible. I promise. Alright, so just close your eyes for me, and let's place the first thing on. And can you tell me what that is? Good, very good. Okay, now I'd just like to take a sip of water. Just there. Okay, right, now let's test the other one. Okay, close your eyes. And can you tell me what that is? Good, good. Okay, so that was some sugar and some salt. So just testing that you could taste both of those, and you could. So well done. Now for the next part, I just like to take a look inside your mouth. Okay, so I've got a little cotton bud here. Okay, so could you just open your mouth for me as wide as you can? Alright. Lovely. Okay, so I'm just checking the condition of your tongue. That all looks healthy. That's good. Your mouth in general looks in good condition, so that's good. Just nod your head if you regularly see your dentist. Good, good. I can tell. Okay, and can you just say "ah" for me? Okay, good. And again. Good. Okay, now. Okay, so now I'm just going to place my hand on the side of your cheek. Okay. And I just want you to try and press your tongue against it. Okay? Okay, and I'm just going to push a little bit and just try and push back. Good. And the other side. Lovely. Okay. We, my friend, are all done. So take a sip of water and I will tell you your results in a moment. Alright? Okay, so let's just go over what we tested and the results. Alright, so your optic nerve, so your vision, all perfect, okay? Couldn't see any issues there. Your ocular motor, aka your pupil reactivity, all good, so we tested that with the light. That was all absolutely fine. General eye health as well looks good. Had a little look and it all looks fine. Okay, what do we have next? Your acoustic nerve. Okay, so your hearing, all absolutely perfect. Alright, we didn't actually even need to go on to the second part of that testing, so that was really good. Your olfactory nerve, aka your sense of smell, was very, very good. You were able to identify all of the scents, so that was excellent. No issues there. Facial nerves, all absolutely fine. You were able to tell me where I was placing my cotton. You were able to resist certain movements, so I can tell everything is functioning really well. Alright, okay, and last but not least, obviously we tested your sense of taste, and I just also had a look inside your mouth, just did the old R treatment, saw that everything in the back of the mouth was working as it should. All looks absolutely healthy and fine. Alright, so my conclusion is you seem very healthy. As you have been here, I've been observing you, and I can see that you're generally in good health. The way I can tell that is your hair looks in good condition, things like your nails, your eyes, your skin, all looks in very good condition. You generally look in good shape, so I can tell that you take care of yourself, so that's really good. So my recommendation would be that you just carry on doing what you're doing because you seem in very good health. Yes. See, nothing to be worried about. No, I give you the all clear, alright? So you shouldn't need to come and see me again, but obviously if you do have any problems then just pop in, okay? But if anything should occur, like you're suffering from any dizziness or your sense of smell changes or taste, do just mention it to your local doctor, or as I say, you can come back and see me. Okay? It's a pleasure. Alright, so when you're ready, just pop your jacket back on and just head out to reception. Okay? It's been a pleasure. No problem. Alright, bye bye now. Bye bye.